From 5th unit, there are some infectious diseases like meningitis, typhoid, leprosy, tuberculosis, and urinary tract infection. From there, I am going to discuss meningitis in this session. So contains definition, etiology, sign and symptoms, pathophysiology, management, complications of meningitis, along with some MCQs question I will discuss here. Definition, and here you have to know meningitis. Meninges, what do you mean by meninges? Meninges is the covering membrane. It is present in brain and spinal cord. Meningitis, itis means inflammation. That means inflammation in the meninges. And you know meninges present in brain and spinal cord, or you can say meningitis is an inflammation of the fluid and membrane surrounding brain and spinal cord. And the meninges are the three membranes that cover brain and spinal cord, and meningitis can occur when fluid surrounding the meninges become infected. And different types of meningitis. There are 5 types of meningitis like bacterial meningitis, viral meningitis, parasitic meningitis, fungal meningitis, and non-infectious meningitis. And you have to know etiology of meningitis. Etiology means risk factor, or you can say causative factor of meningitis, like cancer, chemical irritation, fungi, drug allergies. And there are 5 types of meningitis is there, and you have to know viral meningitis etiology, that is Westline virus, influenza virus, mumps virus, HIV virus, measles, herpes virus. Due to of these viruses, meningitis may cause. Bacterial meningitis etiology, and you have to know the some bacteria like Streptococcus pneumoniae, Neisseria meningitis, Haemophilus influenza, Staphylococcus aureus. These are the some bacteria which takes place in bacterial meningitis. Symptoms: altered mental status, nausea, vomiting, sensitivity to light, irritability, headache, fever, chills, stiff neck, sleepiness, lethargy. So contains definition, etiology, sign and symptoms, pathophysiology, management, complications of meningitis, along with some complications of meningitis. These are seizure, hearing loss, vision loss, memory problem, arthritis, migraine, brain damage, hydrocephalus, scabies, and secondary bacterial infection. And you have to know the management of meningitis. For the treatment of meningitis, pharmacological drugs is used, some vaccines are available, and non-pharmacological therapy. Non-pharmacological therapy, and you have to wash your hands properly, and you have to take care, and you have to practice good hygiene, and you have to stay healthy. That means you have to maintain your immune system by getting enough rest, exercise regularly, and you have to take healthy diet and plenty of fresh fruits, vegetables, and whole grains. And you have to cover your mouth during cough and sneeze. Some vaccines are available like Haemophilus influenza type B vaccine, pneumococcal conjugate vaccine, pneumococcal polysaccharide vaccine, and meningococcal conjugate vaccine. Drugs are available like antibiotics, corticosteroids, acetaminophen or paracetamol, anticonvulsant drug, oxygen therapy, and fluids, and sedatives. You have to take this medication during meningitis. And you have to know pathophysiology of meningitis. Meningitis caused when any bacteria or virus who is causing meningitis when this bacteria enters into brain or spinal cord, and when this bacteria cross blood-brain barrier, then this bacteria proliferates in the cerebrospinal fluids, which cause inflammation of the meninges and increase intracranial pressure. This leads to meningitis. Here some MCQs is there. These are the very important MCQs. In exam you will get these MCQs. Like first one, meningitis refers to inflammation of the brain. It is true or false? Meningitis refers to inflammation of the brain. And you know, meningitis cause inflammation in the brain as well as in spinal cord. Here only mentioned in the brain. So it is false. Second, is meningitis contagious? Yes or no? Yes, it is contagious. Third, do people die from bacterial meningitis? Yes or no? Yes, people may die. Alcoholism is a risk factor for bacterial meningitis. True or false? It is true. Classic symptoms of meningitis usually include fever, headache, stiff neck, fever, cold, hallucination, headache, seizure. First one is true. Seventh one, there are only two types of meningitis, bacterial meningitis and viral meningitis. True or false? You know, there are 5 types of meningitis, not only 2. So it is false. And eighth one, which procedure is most likely to use to test for meningitis? Throat culture, spinal tap, tuberculosis skin test, none of the above. Spinal tap. Vaccination is the only way to prevent meningitis. True or false? It is false, as because vaccine is available. Along with that vaccine, pharmacological drugs as well as non-pharmacological therapy also there. So it is false. 10th one, which medicine can fight viral meningitis? Antibiotic medicine, anti-inflammatory medicine, hydrotic fluids, none of the above. None of the above. Thank you.